there is very little to be gained in terms of costs by reducing those services, that our income is considerably diminished. The proposition to provide us $300,000 for accident and emergency services, that is but a very small percentage of the total cost of providing those services, especially if it was had to be provided standalone. So it's our challenge to represent to the government that the model we currently have, where we integrate hospital beds, where local doctors can hospitalise their patients and see them rather than seeing them. They're not going to drive 50 or 110 or 130 kilometres away to see them. If they can't see them at Keith Hospital, they won't be dealing with them. So our challenge is, given the huge geographic area that Keith covers, and once again you've probably heard me many times talk about the 10,000 square kilometres for which Keith is the closest hospital and is essentially the only option for many of us. And the 3,500 residents of that area, let alone the 7,000 people that go past the Duke's Highway every day, it is our job, and each one of these rallies and public meetings and every email you send, every letter you write, helps highlight that. It's also interesting to note that this year the grant from the state government, 663,000, as a payment to service 3,500 people, is $191 per man, woman and child. The state health budget of $4.5 billion is $2,800 per man, woman and child, and the proposition of funding for next year is $85. So the inequity is patently obvious in those quite stark statistics. As I've outlined, the board has done much soul-searching over a long time, and 3 months ago we went back to the Minister, having alerted him 3 years ago that the funding we're receiving them not keeping up with inflation, let alone what they call health inflation, and the Minister himself continually refers to health CPI, or the cost and increase of health annually, as being somewhere between 9 and 12%, whereas we've been getting increases of 2 and 3%. Compounding that over many years results in those diagrams we've seen over there in that reduction of our income from the state. So we went to see Minister Hill after unsuccessfully attempting to meet with Mr Tony Sherman, who is the CEO of SA Health, and highlighted to the Minister that the time wasn't far away for crunch time. At that meeting, the Minister and the CEO of Country Health SA promised that they would get in contact with us ASAP. Unfortunately, we don't know the reasons why. I understand there was a change in the Country Health SA CEO left, but irrespective, we didn't hear from anybody until, as you know, we all read about it, the funding cut to Keith in the paper. And finally, 3 days later, a representative of Country Health came and saw us, informed us of the reduction in funding from 663,000 back to 300,000. The board, in response to the Minister's proposition, our finance people went through exhaustive processes modelling the different scenarios, and the common theme was the one we currently had was by far the most efficient, where we dovetail all those services in together, use staff efficiently, and most importantly, the subsidy that you as residents, by taking out private health insurance, by the volunteerism of extraordinary levels that you contribute to the hospital, let alone the donations that result in things like the 5 refurbished hospital bathrooms recently, save the hospital a lot of money and save the state a lot of money. We don't get a cent from the state for infrastructure. The federal government has been very good in supporting our aged care wing and now the medical centre. On Monday we had quite a few press come through the hospital, and Sarah was initiative to try and capture some of the press that had been down to for Mary McKillop's canonisation celebrations at Penola. And we did a range of interviews, and I spent quite a bit of time with each of the organisations before I conducted interviews. And in one instance, a gentleman who was very well credentialed, as I was briefing him, he said, but a reduction of $370,000, how can that be significant? That can't be the difference between you being here and not being here. And I said, well, what do you think the Keith Hospital costs to run? He said, oh, 10 million, 15 million? So when I told him that last year it cost us 2.4 million, he was absolutely amazed, because he'd just been through a tour of the hospital. He'd seen the magnificent facilities that this community has maintained and developed over time, and he saw the staff and the residents and how happy they were, and he was absolutely blown away by that. So while we think 2.4 million is a lot of money, to other people it is but a pittance. And we can all be very proud of the facility that we've maintained over time here and the high quality services we have. The other thing that's changed in recent years is the accreditation processes, both the federal government for the aged care and for acute care, are incredibly comprehensive. They take an enormous amount of staff time, and we frequently receive random audits, and they are incredibly detailed. It all comes at a cost, and while we go to great lengths to minimise those administrative overhead costs, and board members contribute quite a bit of time on issues that would normally undertaken by paid staff, and we have lots of volunteers working all throughout the hospital on a daily basis. Nonetheless, as reflected in that health CPI I was talking about before, that is frequently 3 and 4 times what the normal consumer CPI is, we haven't been receiving the funding that the public system has, and hence the dilemma we have now. But we are confident that the government will listen as a consequence of all the activity that's been taken at the moment. And just yesterday, James spoke to Minister Hill's chief of staff, and we hope that heads somewhere productive. But I hope I've given you some insight as to how the hospital operates and how it's funded, and why we have suddenly come to this crunch, essentially for 2 reasons. One, the erosion over time of the state government's contribution to the hospital, and then obviously this huge funding cut on top of that. Thank you for listening.